Konversasyon, de Topik Konversasyon, de mardi, nous cause bonne ciser la santé. Et aujourd'hui, nous pour cause inciser, mon connaît qui pour intéresser, c'est tout bon monde qui peut faire face avec bonne, pareil nous dit, bonne maladie la peau, bonne common skin diseases, bien sûr. Et aujourd'hui, nous pouvons avec un dermatologiste et aussi un cosmétologiste qui joignent aujourd'hui bon matin, qui nous pour cause. Un petit peu, là, ça ciser, existe pour moi faire un rappel pour dire son clinique, il a même là bas étage son clinique il nous veille dans 3 semaines depuis les in fait ouvert alors si waouh c'est pas intéressant envoyez une question sinon parce que dans même là bas pour cause un petit peu pour aborder un petit peu ça c'est il y a qui m'a how the best she can help you avec ou skin diseases aujourd'hui bon matin mon un grand plaisir pour présenter avec Dr. Pillay. Good morning.
Good morning.
How are you?
I'm good, thank you. And you?
Oh, bien merci. You understand the word?
Yes.
Et je me fais rappeler Dr. Pillay, il y a des gens qui naissent ici, Cécile, mais souvent ils disent ils sont créoles, pas trop bon. Alors ça, nous interview ils pourraient qui en anglais, mais souvent ils comprennent en créole, ils sont capables de texte en créole et ils sont capables de répondre nous, bien sûr, en anglais. Ils naissent ici, mais souvent ils ont fait souvent des études dehors et tout son avis. Ils vivent ici, après ils travaillent avec le ministère de la Santé, ici même Cécile, et après ils travaillent avec Euromedical et après là, il a ouvert son clinique privée qui nous peut cause Lola. Dermatologist. Why dermatologist?
Dermatology has always been my department of interest since medical school. It's been like, because skin is very important, it's the first thing someone visualizes on meeting someone. So it's very important any disease or any cosmetically, aesthetically visible lesions on the skin to be rectified is very important because it gives the first impression to a person.
To a person is the very first thing that we see when you talk to a person. If there's a skin disease somewhere or in the face or any part of the body, you can quickly identify it.
Yes, correct.
And cosmetologist.
Cosmetologist, it's both together. Like even though dermatology is more to do with the medical science, cosmetology also forms a part of it because sometimes what happens with skin diseases, they can leave behind scars and permanent pigmentation. So to rectify this, I also combine cosmetology with my studies so it can be a complete cure to the problem.
A complete cure?
Which means it's not only getting rid of the disease, it's also the post-inflammatory conditions which occur to the skin. So which means it's not only the temporary rectifying the problem, it is also like, because the scar can give a lifelong insecurity to the person. So just to completely get rid of the skin condition, I had to combine both. And also aesthetically, I also do just cosmetology, that is anti-aging treatments, and people who feel they just need a little, I mean, they're already beautiful, but they just want a little more boost. They just want a little more confidence.
Feel comfortable.
Yes, correct. So it's just, just for some fine wrinkles, for some tanning, for some pigmentation, hypopigmentation, hyperpigmentation. So all these conditions, it does help with cosmetology.
Leaving no scars at all.
Well, we can minimize the scars. Some scars cannot be completely removed, but then we can definitely minimize and make them feel better.
Voilà, docteur, il expliquait. Nous pour causer un petit peu le bon service qui est offert par dermatologiste. Si il arrive un petit quelque chose, et pour la peau, comme si il peut trop commencer traumatiser ou pas capable de guetter, il vient à sort. Pareil, nous dit ou sentir inconfortable ou envie de retirer et pourquoi pas. Quand le docteur Pillay, là, à étage, il est capable de faire ça dialogue avec lui, ou dire qui a envie, si vous avez envie de réduire, tirer complètement, oui, il est possible que le docteur Pillay soit capable de faire ça. Alors, ça va une question, si on a le docteur Pillay va aider, là, peut cause n'importe qui quelque chose qui a la peau, skin diseases, qui est senti inconfortable avec, et pas vivre avec, ou pas né avec, il partit là, il vient, tout ça là, senti inconfortable, docteur Pillay, il a aujourd'hui bon matin, il peut expliquer, bien sûr, et de son clinique, il est capable de faire ça pour. What are the common skin diseases that you have identified or observed here in Seychelles?
Okay, so the most common few I'm going to talk about today, the first one is going to be the fungal infection.
Fungal infection.
Yes, which is very common due to the tropical climate, the humidity and the sweating. So they commonly call it as ringworm infection because of its presence. The way it appears as a circular lesion. So you can see this condition can be very itchy. So what happens, you can notice some active borders, so they keep getting bigger. Normally the central area is clear, but then due to scratching, the person just tends to spread it to other parts of the body, and it can be very discomforting sometimes, like because they can appear in intimate areas, so they can be very itchy and discomfortable. So
it can happen. It can come all over on your body.
Yes, like you can spread it yourself by scratching.
By scratching.
Yeah. So it needs treatment. So first of all, we have to give some antihistamines to stop the itching. And then we have to control the fungus itself. And then we do give advice on how to prevent it further, like to keep yourself dry, clean after sports or any work, because people here have a tendency to sweat.
How long does it take for it to completely go up?
1 week of proper treatment should be fine.
1 week?
Yeah.
But what happens if it persists?
If it persists after treatment, there are different strains of medication which can be used. So we have to identify the right type and give the treatment accordingly. If it's still persistent, we can do some test called the KOH test, which can identify the type of fungus and then give specific treatment for that. Normally, it's not very persistent. I mean, it can reoccur. There are chances of recurrence, but then once you get it, it's easily treatable. So there are options to treat.
But for one person, it can be repeated 3, 4 times.
Yes, yeah, that's why we do explain to them on how to prevent it, like further. Especially, they can spread it among the family members if they are sharing clothes, towels. So all this we tell them, we explain to them on how it can stop the spread and how it can be prevented.
Doctor, I know some person having this fungal infection, and they told the patients to wash their clothes in hot water, do not use the same cutlery things, everything.
No, cutlery is fine, but direct skin contact like clothes can be washed separately. I mean, it does help. Not necessarily hot water, but then separately is more important. And no sharing of clothes, no sharing of towels is also important. And because there can be kids in the house who come and play around, so direct skin to skin contact can spread it quickly.
It can spread quickly?
Yes.
Direct skin contact, c'est madame Mamzelle bon matin là, nous peut causer fungal infection, ça qui nous dit fungus, l'eau, la peau, bien sûr, et expliquer comment il est capable get rid of it, capable tirer dans une semaine si il insiste, il persiste, il peut dire quelle qualité à cause de différentes qualités ça fungus là, qui l'eau, la peau, il y en a qui gagnent dans coin quand nous pousse là-bas, hein, depuis quand nous pousse les pieds partout, nous les corps entiers, il est capable d'arriver et le docteur peut expliquer comment il est, il faut dégueter quelle qualité type. Et si vous grattez, il tombe dans l'autre partie où le corps, là, bien si il peut lever, pour continuer à ça, nous pouvons être capables de connaître qui peut faire, how to stop the irritation.
So the itching, it has to be stopped with medication, antihistamine. So there's no harm. So no need to be scared that you're taking so many medication, because the first line of treatment is to stop the spread. So we do prescribe antihistamines, and it does help a lot. So that is the first line, and then we go to the antifungal treatment depending on the age and the person, like their lifestyle, everything has to be seen before giving the treatment, whether just topical treatment is sufficient or we have to give oral medication, because just to see side effects on the age groups, so we have to decide on the person.
What is the first symptom, the first sign maybe?
First symptom will be slight redness and irritation. And then you can actually notice the lesion as you're seeing it.
So that we don't get confused with the normal rash?
It has a typical circular characteristic, and it has a very active border. The borders will be all red and active. The center will be clearer. So you can see it spreading out like in
It
active.
grows, like
yeah,
it grows?
Yeah, it grows. It can grow. And you will notice when you get one, it starts to get itchy, and then you will see the nearby areas also getting the same type of lesions. So this is very commonly seen in skin folds where sweat can accumulate. That is, it can be under the breast, it can be in the thigh area, it can be in the lower abdominal area where the skin fold is accumulating sweat. So it's very common in these areas.
Surtout nous ici, dans nos climats ici, c'est nous pays, nous étant ici et nous transpirer. Nous transpirons beaucoup et c'est ça qui est capable de faire nous gagner ça bonne l'infection fungus. Alors, restez vigilants quand nous les corps y concernent surtout dans la à côté il y a un petit peu épais quand ça nous transpirer ça de temps en temps les espaces là mais un cours. Does that mean that we have to take bath frequently?
No, it doesn't make a big difference. But then, yeah, after shower, we do prescribe some antifungal powder. And if you're sweating, just keep yourself dry is more important. Yeah, of course, we have to shower every day, but then just showering more frequently doesn't get rid of the fungus as such. So more important is keeping yourself dry. After shower, drying yourself well, taking time to dry out your skin folds where the sweat accumulates is more important.
Et bien, si pour Kintex, nous pouvons causer fungus, l'eau, les corps, pas ça dans l'office. They are asking question about the office fungus. This is another thing.
No, see, I've had patients who come with fungal infection where the office has been contaminated with the fungus. So, yeah, it can happen. It can happen. But that is more with the respiratory fungus. But then I do get skin conditions as well. And when we test them for fungus, they are found to be positive, and all their colleagues, when they come, they all have the same characteristic lesions. So fungus from the office can also show on the skin.
Can also show it can also show on the skin, but can fungus dans l'office. Voilà, docteur dit it can also be shown on the skin. Et en même temps, nous pouvons causer pour mettre bon portrait. Bien sûr, pour docteur cause là, en même temps, nous pouvons causer bon différents skin diseases. Nous pouvons mettre un tampon qui nous peut causer là. Encore, on dit tampon.
Tampon, yes, correct.
Docteur. Voilà, docteur Lee. Il y a un petit peu commun.
This is very common. This is very common. This is a type of yeast infection.
Yes.
So this is normally present in 90% of everyone's body. It's there, but then in some where it multiplies in an excessive amount, that's when it shows as a white patch. So this is very, very common here.
It's very visible as well.
Yes, it's very visible, yeah. And the thing is, it's very stubborn also.
Yes.
Yeah, it's not like the other type of fungus I was talking about, just a 7-day treatment. This one, the treatment takes longer. Even when the fungus dies out, the white patches does remain for a longer time, even though it's not active. So patients really find it uncomfortable because sometimes it's in the visible areas also.
Very uncomfortable.
Yeah, so for this, we do have shampoos and more than oral medication, topical medication works better for this type of fungus. It's called the P. versicolor. So I advise them to apply the shampoo leave-on for 10 to 15 minutes and shower every day, and this really helps.
What about Selsun?
Yeah, Selsun is one type of the shampoo which is used. So mainly the type of antifungal used for this is ketoconazole and cyclopyrox. So the Selsun does help up to a certain extent. If it doesn't, then we go for other
treatments?
Yeah.
So, but the very stubborn one, what does it mean?
Well, it's just a person's skin type, and it's also to do with their lifestyle. Some people, you know, they're like divers. They're out in the sea every day. So for these type of people, it can be more stubborn because they're getting re-exposed to the humidity, and then they are staying in their wet clothes for a longer time with the sun, and all this helps to multiply the yeast. Otherwise, just a normal office-going person who's not too much exposed to sunlight, it can be easily treatable.
Dr. Pillay, can pseudocreme be of help?
Pseudocreme is an emollient. You see, it's like an emollient. It can definitely help with the dry skin. It cannot be used as the only treatment. It's not going to help, but then it definitely helps to soothe the skin. It helps to bring down the irritation and the dry skin, because when the skin is too dry, it can crack and it can lead to other infections. So in that case, it keeps it moist, but then it's not the only treatment for this type of fungus. It's not just going to cure it.
Pour bon di moun qui peut verser qui peut faire face avec tampon bon qui very stable même pareil nous dit y aller venir y aller soit pas du tout ou soit si y aller qui un petit marque alors ça passe un petit coup que le docteur Pillay là bas étage donner un petit call et avoir qui manière capable aider côté traitement il concerne treatment lotion or tablets.
Yeah, it's mostly the medical treatments, lotion and topical, yeah. For the tinea, the first type of fungal infection, we have medical treatment which works. But then for this P. versicolor, the white patch ones, the topical ones are better.
The topical ones.
Yeah, but you should be mentally prepared to take the treatment for some time, at least 2 to 3 weeks. It's not going to go away overnight.
It's not overnight. C'est loin de quelque chose. Un petit coup là, il peut aller, mais il peut prendre un petit peu de temps. À 3 semaines pour lui complètement, comment se réduire. Après, nous pas aller ensuite. Qui pas retourner, nous voir nous l'autre qui docteur nous mène pour share avec nous ici c'est nous porter this one doctor.
Okay, so I'm also going to talk a little on the skin cancers.
Skin cancers.
Being very hot and a lot of exposure to the UV radiation, I'm going to talk a little bit on the skin cancers. So the most common type is the basal cell carcinoma. So this can be easily noticed at an early stage and can be taken care of. It can be cured. So, and also I also advise my patients on how to prevent this, especially when they are light-skinned, to use sun protection every day and how to keep yourself away from the radiation and the rays because some skin types are very prone to develop the skin condition. So the common ones we see is the basal cell carcinoma, and it's not a very dangerous type. But if it's noticed at an early stage, it's a very localized type of cancer. So it can be removed and we can prevent it from spreading to other parts. So yeah, I'll also tell you on the next picture will actually, yeah.
Let's take this question regarding skin cancer. It says, morning to you, how can people detect cancerous skin moles?
Yes, that's my next picture.
It's the next picture.
Yeah.
Voilà, aucun texte nous là.
Okay.
Là, docteur, pour répondre un petit coup là. These are the ones?
Yes.
Okay.
So, see, there is A, B, C, D, E. These are the criteria for you to just check at home in case you suspect anything. The first is the asymmetry, so which means the lesion is not symmetrical. The mole you have, if you draw a line in between, it's not going to be equal on both the sides, the shape. So that is the first one, the A. The B is the border. The border is normally ill-defined. It doesn't have a proper, well-defined border. It has a very ill-defined, so it has this very bizarre shape and border to it. Yes.
In other words.
Yeah, you cannot define the border as such. And the other one is the color. The color of it is not uniformly colored throughout the lesion. The lesion will be hyper-pigmented in some areas. In some areas will be lighter, so it will have a very mixed color. It's not going to be like a straight color.
So this is an early detection?
Yeah, like if you have something like this, it's better you come to a dermatologist or a doctor and just get it checked under a dermatoscope. These are not definitely a 100% thing that it is cancer, but then it should make you suspicious. It should make you come to a doctor to get yourself checked.
If you have any abnormality, please report at the earliest possible so doctor can check. Après la résultat qui vient, il est capable de dire quoi qui était exactement. C'est pour retirer un doute, c'est comme chose qui est abnormal, qui partit là, un seul coup, il apparaît des 3 jours, après il vient soit grossi, soit pas. Juste grand contact avec des dermatologistes, docteur Pillay, il y a un parmi qui nous aide là, qui est capable de dire quoi ça nous peut causer common skin diseases ici in Seychelles. So we have questions from our viewers. Good morning. What about, un mot là qui m'a pas dit, it's a big word, doctor. Syndrotic eczema in the palm of the hands.
Okay. So there can be various reasons for this eczema. Okay, see, normally people with this eczema, they do have a predisposing hereditary condition sometimes. Sometimes it's to do with their work.
The work.
Yeah, if they are dealing with if they are dealing with chemicals and different types of detergents, washing powder. This can irritate the skin and cause, it's also...
Is it the substance in those?
Yes. Well, it can be fine with others, but for some it can give a very dry, some vesicle types of lesions on the palm, itchy, dry, cracked lesions. So this can be treated also, but then I also explain to them on how to prevent it. They can use gloves at work. Sometimes the rubber gloves can also irritate their skin. So in that case, they have to make a fabric glove for themselves and then use the rubber gloves on top. So if they have this condition, it's better they prevent it by using the gloves. They shouldn't come in direct contact with these chemicals. Sometimes it can be sanitizers, it can be just normal hand wash, but it's just their skin type, it can react and it can cause this type of eczema.
Voilà la réponse pour une question qui on demandait regarding eczema. Bien si nous peux venir tous les, un portrait qui nous mettait. Bien si à présent nous parlons cause là ça un portrait qui est relié avec eczema. This one, doctor?
Yes, this is also a type of eczema, but this is atopic dermatitis. This is something we commonly see.
I've heard this word before.
Yes, it's very common in children. In a smaller age group. Normally it disappears after 5 to 6 years. It gets better.
Yes.
It does get better. But then as an infant, it can be very disturbing because it makes the skin very dry, itchy. And cracked, and it can ooze out clear fluid. And it's normally a hereditary condition. It's associated with asthma. So since asthma is quite common here, so this skin condition is also related to it.
Can be related?
Yes.
What is the treatment for that?
Treatment first line of treatment is emollients, that is keeping the skin moisturized always, hydrated and moisturized, because the dry skin can further trigger the itchiness and it's very itchy. The skin condition is very itchy, so this can cause infection and can lead to spreading to other parts. Like it's not contagious, this is not a contagious condition, but then the itching can be very uncomfortable. So we do give, first we tell them to hydrate the skin. Once, if they still persist with this condition, then we have to go for oral medication. And sometimes cortisones have to be used to just help them and to suppress the body from reacting to it. Sometimes it can be external factors like the climate, dust, cement, construction works going on, cement, change of milk for the babies, introduction of certain foods like nuts, some fruits, some preservative.
But don't we say nuts are very healthy?
Yes, not for all though, because with this atopic dermatitis, they can trigger the condition. But then this is for a short while. After 5 to 6 years of age, it normally goes down and they can lead a normal life. But then till that age, we do have to. At a later adult age, there are chances, but very rare. Very rare. Normally, it's only the childhood, but it's very common here. Because another reason could be the use of formula milks more frequently. So at an early stage, that is before 6 months, introduction of formula, so it might not go well with them and it can trigger. They might already be having the condition, but then this can trigger it further.
More quickly.
Yeah.
Some people tend to use the Vaseline petrol. You know the Vaseline petrol? They tend to use it on the eczema. Is it necessary doing anything for it?
It is an emollient. So as I said, it can help to keep the skin from drying, but then sometimes this is not enough. You have to go for medicated products. Even with the emollients, the moisturizers, you have to go with the medicated products just to sustain it a bit longer. And it normally happens on the skin folds also, that is behind your knees, under your neck.
In the joints?
Yes, joints. Yes. The flexural areas, we call it, where you fold. So all these areas are very commonly affected by this.
Bonne réponse pour votre question. Bien si nous peut cause l'eczéma et ou qui texte nous, Dr. Fiona is asking, what about eczema? Eczema has already been said. And tambav. You've heard the word tambav.
Tambav is the type of fungal infection, right?
Type of fungal infection.
It's what we spoke about earlier.
Mas o besoin nous, il gagne classifier comment est qualité l'infection fungus, nous capable de dire et docteur Plibonnet il expliquait ça. Une autre question qui dit Beaucoup. Bonjour à tous, bonjour aussi. Il dit beaucoup ça bonne maladie la peau, nous bonnes grands-parents qui fait ça très bien avec mon traditionnel medical. Tampon, il y en a des qualités, il y en a qui allaient venir par une docteur il dit traditional remedies for these skin diseases. Do you consider? Do you recommend?
No, not at the moment, because it does help for some. It can make it worse for some. So we are not actually encouraging it at the moment, because it differs. The result differs from person to person. So because when it becomes severe, it becomes really severe. So then they really need medical help at a stronger level. So at the moment, traditional herbal medication we are trying to avoid, because we don't know what can trigger it. So it can be the components in the treatment, like certain plants, extracts, some natural extracts.
It needs more research?
Yes, it does need more research, and the treatment is different person to person. It varies, the result. Some people can accept it better. For some, that itself can cause a trigger to the eczema and make it worse.
It needs more research, or it's not medically proven?
Yeah, it's not proven.
It's not medically proven. It needs more research regarding nous ban ti remède traditionnel par on dit longtemps nous ban grands-parents ti fait ben oui l'état où était un peu il ti aidé typical one là tout avec gros bombe that's a typical one ça il vraiment aidé mais seulement it's not medically proven mais il y a plus recherche qui devrait faire à cause différents la plante ou pas connaît qui en a là-dedans bizarre et recherche en effet recherche docteur avant it's medically proven.
Yeah, a lot of things has to be done, but it's not like why I'm insisting on this is because it's not like a 100% thing that you might be wasting time on it sometimes. You might be thinking, so some things they need a quick remedy. So this can take time. The homemade treatments, it can take longer. So it's always good to have a analysis first to get it diagnosed exactly on what it is. Sometimes they might think it to be eczema, it might not be. So it's always good to get it diagnosed first and then start the treatment. Yeah.
Doctor, more questions coming in. Morning to you both. Morning. What about pigmentation? Do you treat that too?
Yes, we do treat pigmentation. We have medical treatment like creams, like kojic creams, which we use for the pigmentation. And we also do chemical peeling. So chemical peeling is a very simple process, but it's very effective. We've done it on many patients here in Seychelles. It needs multiple sittings. It's just a solution we use on the pigmented area. We leave on for like 2 to 3 minutes and then we remove. So what happens, the top layer of the skin tends to peel out, and then when the new skin grows, it's smoother, lighter, and so with repeated sessions, it can get rid of the pigmentation. We also have lasers in very stubborn pigmentation conditions. We have lasers which can get rid of the pigmentation.
How many sessions do you need to get it rid?
It depends on the depth of the pigmentation and the size, but then we say a minimum of 3 sessions. 1 month apart.
1 month apart. Voilà la réponse pour question. Oui, je te fais pour pigmentation, mais seulement pour completely get rid of it. À peu près 1 mois. Je aussi fait laser, bien sûr. Doctor, they are asking about your opening hours at your office.
Okay. Monday to Friday, we open from 9 to 4:30. Saturdays on appointments only from 9 to 12.
On Sundays and public holidays, you are closed?
Yes.
For the moment, or?
Well, for the moment.
For the future. Voilà, les paris ont demandé qu'ils ont ouvert. Can people just walk in, or they need appointments on the weekdays?
Weekdays, walk-in is a possibility, but then sometimes just to prevent the waiting time, it's better you book an appointment so that because we don't know the appointments for the day, so it's always good to book an appointment. But then if you have not booked, you've forgotten, you just want to walk in, you're always welcome.
Cécile, nous cause avec le docteur Pillay, qui est dermatologiste, cosmétologiste aussi. Ici, Cécile, il nous veille dans 3 semaines, sur clinique, il est même là en bas. Mitaz, quand tu es dans la boutique, là, sur clinique, il a une fait couvert pour any skin diseases qui voit abnormal, qui partit là, qui là, pour exemple, capable de se contacter lui. En bas, là, bien sûr, nous cause les autres services qui ont fait, malgré les dermatologistes, il y en a d'autres questions, nous cause laser, nous cause les autres quelque chose, pigmentation aussi, tout ben différents quelque chose qui y fait en bas de son clinique ou quasi se passer pour les formations, pour détails aussi, ou faire une petite consultation, pourquoi pas, et bien sûr, what's the best she can help. People are talking about pricing. What are your pricing like?
I also do general medicine consultation, so that we charge $250 for the consultation. And then for the dermatology consultation, if it's a brief, we have a brief that is a very short consultation because some conditions can easily be detected just on looking at them. So we have a $350, and then a complete dermatology consultation we charge $400.
Voilà, un petit peu bon prix, the ranges of prices qui se peut cause Lola ou capable d'aller pour voir. And the famous one, yes, the famous one, anti-aging treatment.
Okay, so we do have some, I'll start with the lasers. These are the less invasive ones. So it's, we do have the radio frequency laser to demolish the fine wrinkles and to just uplift, to just tighten the skin. And we also do Botox and dermal fillers, this depending on the patient's need. Sometimes it's used as a medical treatment. There can be asymmetry of the face, so we also use Botox to correct that, and the drooping of the eyelids, so it can be corrected, but it can also be used cosmetically on patients' need. You know, some like it completely clear, they don't want any lines, so it can also
nothing
be
at all.
Yes.
Be perfect. Voilà un petit peu le anti-aging treatment. Docteur aussi, il fait un balade, nous dit sa boule là, il commence à tomber, nous avons des wrinkles partout, quelque chose frisé. Pareil, nous dit tout ça là est capable de gagner faire côté docteur Pillay en bas là, ou capable faire visite, guetter côté ou capable voir quand on a quelque chose comme si malgré nous là, ou pas content comme si nous pouvons commencer à friser, nous pouvons commencer à eyeballs, pareil nous dit, wrinkles, tout ça là, cause la fatigue, vous connaissez, la fatigue aussi joue un grand rôle, nous la peau, nous la vie, nous les corps, tout ça là, stress can be one factor of the wrinkles.
Yes.
Yes.
Stress, fatigue, stress, lack of sleep, all this can lead to an early aging. I mean, aging is going to happen, definitely, but then the early aging is what we don't want, yeah.
Trichology, doctor, what is it?
Trichology.
Trichology, voilà, trichology. Voilà, ça un terme médical là, the doctors need to say it themselves. Trichology, doctor.
Trichology is specialty on the scalp and hair. So we also do an assessment of the
there it is, trichology.
Yes. So,
yeah.
So it is, we do hair fall assessment. People coming with excessive hair fall or thinning of the hair, just sudden without any reason. We do assessment with a dermatoscope to
check. For the bald person getting bald?
Yes, we do treatments called PRP, which is very famous at our clinic. We do it, and we remove the patient's blood. We remove and we separate the protein-rich plasma, and we inject it back, and it helps to trigger the hair follicles, and it does help to grow back again.
Ça qui nous dit sauve en créole, voilà, docteur aussi est capable d'aider sa trichology qui nous dit sauve, bon fallen hairs, nous dit bon hair ou CV qui tombe, qui peut tomber de façon pas normale because our hair needs to fall. At some point.
Yeah, it does fall at some time. It's only the abnormal falling of the hairs.
Yes.
There's a count of around 100 hairs per day, which is fine. But just beyond that, and which is leading to baldness, and sometimes, especially for men, it is a very they get very affected with the hair fall more than women, from what I see. So it's very necessary for it's just to put up their complex a bit. They really are concerned about the hair fall. So yes, sometimes we just have to provide additional nutrition. Sometimes it can be just lack of nutrition or supplements which can help. Sometimes it needs treatment. So we have to assess it first and decide on the condition.
Doctor, one question is that what if they don't want the hairs to grow? Do you have any treatment for that?
Yes, we do have lasers for permanent hair removal.
Voilà la réponse pour question sur pas bien rien pousser. Voilà la réponse pour question vous êtes capable. Laser can do that for you. Pas sur pas bien pousser ou can pas ou vous êtes capable de faire bien sûr. Par contre, si on a bon CV ou bien bon soie qui peut qui peut tomber en plus, là il y a un problème, mais ça aussi de toutes les façons, vous êtes capable d'organiser, comme docteur Pillay, en bas ici, Hermitage, dermatologist, cosmetologist, now the famous one, cosmetology.
So for cosmetology, we do the anti-aging treatments. We do skin tightening, we do body contouring, we do have the lasers. Like you can see, we can do tattoo removal, we do the permanent hair removal. So there can be really unwanted hair on the face, upper lip, chin on women due to hormonal conditions. It can happen. So this can be minimized or removed with the multiple laser sessions, like underarms, arms. Sometimes there's excessive hair growth which has to be under control. And then we also do sclerotherapy. This is for the varicose veins on the legs. So we do, yes, we do injections and we do have lasers, and then scar treatment, like just to smoothen it a bit, or if it's pigmented scar, to reduce its pigmentation. All this cosmetically we can use. And as I already told, we do use Botox, fillers, anti-aging treatments, and we do have chemical peels for the pigmentation. So all this comes under the
side effects, doctors, in all of this cosmetology?
Side effects are very minimal. Because everything we do are mostly non-invasive procedures. They're not like a surgical procedure.
What about the lasers?
The lasers, they don't have, they're specifically designed to treat the skin. So they do not enter deep into your system, and it's not, but whatever side effects we do explain to them, like there can be, because it's a tropical place, once you go out, it can cause some pigmentation or tanning, but we do tell ways on how to prevent the side effect. So once you start the treatment, we insist on using the sunblock. We give it to them side by side. So once that is taken care of, the side effects are not there anymore.
Voilà, la réponse pour question, cosmétologie aussi qui gagne faire, ben si, son petit quelque chose qui vient avec, un petit sou, un petit lasan, side effects very mild. Regarding sabon qui fait que docteur Pillay, sinon tout bonne chose qui nous cause là, les autres services qui offrent nous cause common skin types, common skin diseases qui identifié ici c'est celle qui est capable d'aider aussi par exemple si vous pas sentir confortable dans ou la peau, voilà, dermatologie, voilà qui est spécialisé là-dedans, nous peut causer aussi le bon skin assessment qui gagne faire avant il y a de bon dialogue, il y a un eczema, scabies, head lice, tinea.
Tinea. That's the fungal infection we were talking about earlier. So it comes under that, and yeah, we do skin assessment. These are just few skin conditions we've listed out, which people know, but then we do many more as well. We do wart removal, viral wart removal. We also give treatment for psoriasis and vitiligo. Even though these are autoimmune conditions, we can help to minimize its condition. We do offer phototherapy. We have the narrowband UVB, which can be used other than the medicine itself, because there's not much medication present for these autoimmune conditions. So we do use the light therapy to make them feel better.
Again, side effects very mild.
Yeah, with the phototherapy, it's just kept for 1 minute. It's all like monitored, and it's done person to person, so that the side effects are as minimal as possible. So don't need to worry about side effects for the treatments. Yeah.
Scary, but interesting. En français, nous dit ça. Il faut souffrir pour être belle parfois, mais seulement tout ça là, nous besoin de nous quand nous les corps ils concernés, quand nous sentir, nous besoin arranger un petit gain. Não por beijão arranger malgré nous prévier the skin is saggy and everything. We need to lift that up. So pour une petite visite, quand le docteur Pillay il fait tout ça là, quand il tout ça bon qui nous mettait aussi la télévision, il pas nécessairement tout qu'il fait. These are examples qui quand clinique il fait quand dit mais seulement moi me conseille pour aller un petit coup quand docteur Pillay pour guetter quoi qu'ils ont fait plus. Qui ça qui nous peut causer là bon matin bien sûr pour capable gagner copain et sur ou sentir pour envie faire quelque chose avec tout ça bon service mentioning today ou sentir capable faire quelque chose avec les corps bien sûr il concerne était pour lifestyle et là pourquoi pas docteur Pillay va s'y cause ta causer ta faire ça dialogue et avoir how the best she can help. Anything we've missed? We have left out?
We have covered mostly the common ones. Yeah, but for a more detailed analysis and detailed diagnosis, yeah, I'll have to see the person.
They have to report.
Yes, it's better I see them in person and then decide on what to do.
Apart from the office down there, Hermitage, any contact, phone number maybe?
Yeah, we do have the office, the clinic landline number. That's 432-5005, and we also
432-55?
No, 5005.
5005.
Yes, and then we have a mobile number with WhatsApp. That's 250-5005.
Voilà, un numéro qui est capable de téléphoner, sinon, si vous êtes capable de working, le docteur, si vous n'avez pas le téléphone, comme ça, vous êtes capable d'aider, n'importe quelque chose que vous voyez concernant la peau, là, la peau, skin diseases, quoi que vous avez envie de faire, en plus, qui vous déjà été, par exemple, il faut souffrir pour être belle, mais parfois aussi, les temps, pas bon, comme si des gens arrangés, il faut des arranger, docteur. Any last words?
So just a small bit of advice. Being in a tropical country, it's necessary that everyone starts using a sunblock, take protection from
lotion.
the rays. Yeah, lotion. Make it a daily routine to have a good skin throughout, because the sun rays can also lead to other things like not only skin diseases or infections, it can also delay your aging. So like it can prevent fatal conditions like the skin cancers, melanomas. Yes, yes, it's true. So use a hat when you go to the beach, and find the right sunscreen suitable for your skin. Use
I was going to ask you about this. Given that we are in a tropical country, what's the best one?
The sunscreen, the basic recommendation, we say a broad spectrum, UVA, UVB, SPF 30 minimum or above is fine, and water resistant is also important. It shouldn't, the sweat shouldn't wash away your sunblock. And if your work involves a lot in the sun, it's advisable to reuse after 3 to 4 hours. So, and you can also use other barrier prevention like using hats, umbrellas. All this, you know, it also prevents. So just take a little care and moisturize your skin regularly just to have a healthy skin throughout.
Even if we stay in the house?
Staying in the house is okay, but you know, sometimes staying in the house, you might walk into your garden, you might go hang out your clothes. All this, you might take it as, you know, you're inside the house, but then it does have exposure. A little sun exposure is needed for the body, for your vitamins,
D, yes.
But then excessive sun exposure, sometimes it's really hot, and especially light skin, they really have to make sure they use it every day. Starting at an early age is important. Because all the exposure accumulates and it can show at later age. So it's better you start at school. From school, it's better children start using it, and then so that they can prevent skin.
The earliest possible, yes. Please get your sunblock cream. Facile, il y en a des trois côtés la cou, et dans le sac aussi à cause que Pierre lance, par le docteur dit, mettez ça pour. Mettez bonne jolie sapo la paille comme là, bonnes enfants, des petits casquettes, des petits cap pareil, nous disent ça fait si wear your sunscreen, bien sûr, et bien sûr nous pour demander il envoie un portrait pour demander docteur quoi ça, somebody send us this picture, this photo, and he or she is asking what is this before we conclude.
The photo is actually not, okay, so there's another one.
Yes.
It's
the same thing, but on different parts of the body. Yes, looks like a fungus. I don't know. I'm not the doctor.
No, actually, the two different pictures, they look it's the same person, yes. But the lesion looks different in the different location. I see one is, this is the back. I can see this is the back, yes. And the other one was the
arm,
the elbow,
looks like the arm.
The elbow.
Elbow.
Yeah. So see, I'm just talking from the picture. Okay. It's very difficult to come to a conclusion because there are a lot of factors. I need to ask the person this history to be taken. But then there are chances this could be atopy, being in the flexural area of the body. But then, yeah, the one on the back, there are a lot of chances it could be the tinea also. But yeah, I need to evaluate. I need to ask more questions to the person to come to a conclusion on diagnosis. But there are chances it could be this.
It could be.
Yeah.
So, aucun de vous nous apporterez. Merci beaucoup. Nous apprécions, mais sûrement très bien. Si vous avez un docteur, un petit call, mais sur un petit temps, parce que dans la clinique, là même, là, Hermitage, là, le docteur va vérifier, identifier, il a fait quelque chose et là, il a dit au résultat, pas trop tard, hein, just report, et comme ça, on va tirer un doute quoi ça aussi. Docteur, thank you very much pour faire le temps. Pour joindre aujourd'hui, on such a short notice, yesterday it was like, what, 5?
5.
Yes, pour aujourd'hui, bon matin, mais seulement merci beaucoup, bon courage. And I'm hoping that you get more people come and visit you at the clinic down there.
Yes, thank you so much. Thank you for bringing me in. It's my pleasure.
It is absolute pleasure. Thank you because you have a response in such a short notice. Thank you, Dr. Muti, for giving me Dr. Pillay today just to fill in the slot. Just to fill in the slot because originally this slot was for Ministry of Health and they couldn't come with no excuses. But thank you so much.
Thank you
have
very
a blessed
much.
day today.
You too. Thank you.
Et bien si, c'est ça, c'est le Topik Konversasyon.